Welcome to the podcast on health. That's week 2 module promoting health and exercise. So before starting, let's have some discussion what we completed last week. Last week we unwrapped the module details that what the module is and what you're going to do in this module. We are going to be discuss about the two learning outcomes and in live session, then third learning outcome of this module that are related to your assignment as well, the question one of the workbook. So by the end of this session, you should be able to define health and well-being, identify and categorize different types of health influences that you are going to cover in this podcast today. And after this, when you are coming to the campus to attend the live session, you are also analyzing how multiple factors interact to affect health choices in a case study. So please listen carefully as you are applying this knowledge in your assignment as well. Part one workbook. Its question one is related to it. So before discussing and proceeding, let's discuss about health. What do you think health is? So before discussing the definition, I want you to further scan this QR code and share with me what do you think the definition of health is. 1948, WHO defined health as a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. So it means health is not only that the person is well, not experiencing any subjectively of feeling unwell or sickness that's socially and culturally defined entity, no any disease that's a pathologic process going on the body. However, the person is also from the outside physically looking fine. What are their emotions and social well-being as well that affects, and that's holistic called as health. Whenever we discuss about the health, so of course the concept of also coming that what is mean by well-being. Well-being actually refers to a state of being healthy, happy, and comfortable, encompassing physical, mental, and social aspects of life. It's not just the absence of illness, but a positive state where individuals feel good about themselves and their lives. Good well-being is characterized by feeling content, satisfied, and having a positive outlook on a personal and professional experience. So, well being is actually a broad concept that considers both subjective feelings, that's the pure individual personal feelings, where the subjective feelings called as that is how individuals feel, perceive, and evaluate their own lives, including their feelings of happiness, life satisfaction, and meaning. However, it also a concept that relates to the objective factors as well, such as the health and social connections. For example, in this figure, you can see some aspects of the wellness, and I'm discussing with you the key aspects of well-being. For example, physical well-being. Well-being, for example, about the good health, energy levels, physical fitness, mental well-being. Mental well-being is related to that involves emotional stability, positive self-esteem, the ability to cope with the stress and adversity. Like people feeling how can cope with the difficulties and hardships in the life. Next is coming about the social well-being that refers to having positive relationships, a sense of belonging, and contributing to society. This is how individuals perceive it. There is another concept of well-being is as well that is called as the community well-being. This considers the well-being of a group of the people, such as the neighborhood or a city, or how they function together. So, of course, in your assignment, when you are discussing the health, the definition, you are also discussing the different aspects of health and well-being, what these are in terms of the individual and community well-being. So, it's important to have the basic knowledge on them before doing the assignment. Now let's have a look on the wheel of well-being. So what is this actually wheel of well-being is denoting about that it's a flexible and creative framework of health promotion that we use in our health and social care profession at work and in our services. The well-being wheel can be used as a tool to check, for example, while checking our wellness, for example. So your wellness to better understand what is going well, what may be challenging. As you look at the wheel, you can ask yourself, how can align my values with my choices? How do my identities, my strengths, and experiences affect my wellness? How is my community? Okay, now let's discuss about the determinants of health. So what these determinants of health are, these are the conditions in which people are born, grow, live, work, and age. Such as this includes our social networks, socioeconomic conditions that you can see from here as well. In these diagrams and Whitehead model that we use in our health and social care profession at work and in our services to identify the determinants of and environment and also includes the health system where we live. And these collectively called as social determinants of health. So it also helps you to identify and determining the health inequalities that maps the relationship between the individual and the environment and the health. So there are different factors are coming and some of these factors are modifiable, some are not modifiable, which means that we can control them to improve our health. But some of them we cannot if these are not in our control. For example, climate that's coming in the environment. Okay, so these are the some examples. So let's discuss some factors. For example, income and social status. So here is coming the socioeconomic, right? So high income, social status are linked by better health. The greater the gap between the richest and the poorest people, the greater the difference in health. Other examples about education, another factor. Low education levels are linked with poor health, more stress, and lower self confidence. Physical environment that also affects our health. Yeah. For example, safe water, clean air, healthy workplaces, safe houses, communities, roads, that other infrastructures can also come. These all contribute to the good health. Employment, work conditions as well. This is also affecting our health. For example, people in an environment are healthier, particularly those who have more control over their working conditions. Let's discuss some non-modifiable as well. These are genetics, for example, that inheritance plays a part in determining lifestyle, healthiness, likelihood to developing certain illnesses or health issues. However, when we look individual lifestyle factors that the personal behavior and coping skills that we can modify, that we can do. So when we were discussing and looking at this diagrams and Whitehead model, we discussed some of these factors are modifiable, non-modifiable. In this slide, I'm also showing you the example that what the non-modifiable factors are. Age, for example, that we can't have control some diseases and our health affecting by age, of course, that we cannot stop it, delay it, or modify it. Ethnicity, family history. However, some are modifiable. For example, our individual lifestyle factors, for example, smoking, hypertension, diabetes, physical inactivity, high cholesterol blood levels that we can modify by staying active and taking medications, decreasing excessive alcohol intake. Now let's go to the discussion time. So what I want after going through this podcast, please scan this QR code and discuss some questions asked in it. First is why is being healthy important? So you can share some benefits that are coming in your mind and identify 10 or more ways you can stay healthy or become healthier.